A 15-year-old female with anxiety and depression presented to the emergency department with her mom. After telling the mom she ingested some medication from a friend's house in a self-harm attempt, they arrived to the emergency department about an hour after the ingestion happened. She wasn't sure what the medication was, but she took about 30 tablets. She was observed in the emergency department for 6 hours, where she was asymptomatic, had normal labs, and just a mild tachycardia to 105, which the team thought was related to her anxiety. She was discharged to a psychiatric facility for continued workup of her depression, and while there, she began to complain of restlessness and worsening anxiety. She was really having trouble getting to sleep. Suddenly, 8 hours after she left the emergency department, she had a generalized tonic-clonic seizure. EMS was called, who rushed her back to the emergency department where she continued to experience multiple repeated seizures and had a brief cardiac arrest. ROSC was quickly achieved after a few rounds of CPR, and they gave benzodiazepines and intubated the patient. Her post-arrest ECG revealed sinus tachycardia, a first-degree heart block, and a wide QRS. She developed progressive hypotension, and an echo showed she actually had poor cardiac output, so she was placed on ECMO. Unfortunately, the patient continued to decompensate, and eventually care was withdrawn 6 days later. If you think you know what possible toxin could cause such a severe outcome so many hours after ingestion, send your guess in to toxtalk1, TOXTALK1, @gmail.com to take part of our next episode of The Poison Lab.